Prior to myocardial stress testing, you want to ensure that the patient takes nothing by mouth for at least 4 hours. This ensures two things. One, that the heart is the most metabolic active organ in the body. Also, the maximum amount of isotope is taken up by the heart and not the stomach. Now, when you look at treadmill or dobutamine stress tests, you want to discontinue beta blocker medications because they make it difficult to achieve the maximum heart rate. Now, with adenosine and regadenoson induced stress tests, you want to discontinue medications with caffeine and theophylline. And you want to discontinue medications with these two drugs because they counteract the adenosine and the regadenoson drugs. Now, with this counteraction, what it amounts to is an inadequate amount of stress on the heart. Now, one last note here. When it pertains to diabetic patients, you should have their medications and their diets adjusted by their primary care physician prior to any type of cardiac stress testing.